I want to show you one of my favorite dissections that we have here in the anatomy lab. So you're looking at an anterior view of the chest. This muscle is called the pectoralis major, and it's been cut as it would attach to the sternum as well as the clavicle. You'll also notice that the clavicle itself has been cut, so there's a window that allows us to see deeper into the body. Up here, this is the anterior aspect of the neck, so this would be like the larynx or voice box. And then you'll also notice that the sternocleidomastoid muscle has been cut. So normally there'd be a muscle that'd be coming down like this. Now what we can do is grab the pectoralis major and reflect it back. And then we can see the pectoralis minor. It too would be attached to the rib cage, but that's been cut, so we can reflect that back. And now what we can see is a bundle of nerves coming out and going towards the armpit or through the axillary area or armpit and going to innervate the entirety of the upper limb. These nerves here belong to what's called the brachial plexus. This is 17 different nerves that emerge from between the anterior and middle scalene. And they're gonna go all over the place, right? You can see like branches going to the pec minor and pec major. These are the medial and lateral pectoral nerves. You're gonna have nerves traveling backwards to go innervate aspects of the scapular muscles, the deltoid. But you can see, watch this. I'm gonna actually move out the arm here and look at all these. Right? Each of these obviously are gonna have a name. This is anatomy after all, such as the radial nerve, the musculocutaneous nerve, the median nerve, the ulnar nerve. But what's happening is they are all going down and innervating the muscles of the entire upper limb. Now what's interesting is that they're also traveling underneath pectoralis minor. And in fact, there's a condition called thoracic outlet syndrome where there's an inflammation of the pectoralis minor or a tightness that can actually put pressure on the nerves and cause dysfunction of the nerves. In fact, there's a variety of places that these nerves can become impinged, including in some cases all the way up here in the neck. Because you can picture, say if there was some inflammation from, I don't know, maybe like a car accident or something like that through whiplash, that would have a dramatic effect, because that's going to innervate muscles on the entire back, like latissimus dorsi, the pec muscles, the entire upper limb. But there are all these other places, right? If we were to continue this dissection, you could see where all these nerves go. There's going to be impingement sites all throughout here that could relate to muscle weakness, numbness, tingling, so on and so forth. But all this white stuff that you're seeing is what we call the brachial plexus.